What new imaging techniques are being used? How will imaging improve in the future?
So research, just briefly, what are we doing to learn more about the imaging techniques? We can combine PET and MRI. We cannot do it here yet, but there are machines around the country where we can do that. At the moment, the benefit over a PET CT is not that much, so this is just future. We can use new functional techniques where we can actually measure how many cells you have in the bone marrow, not only count them under the microscope, but also can measure them in X-ray. And this is again based on the water content, as I mentioned. If you have a lot of cells, your water molecules cannot move that far. If you have less cells in your bone marrow, they can move further and the machine can measure that, so-called DWI, and it's fancy looking here, as you can see here, those white spots were myeloma infiltrations, and this is a patient in CR. You can see much fewer white spots, but still some left. So we get information this patient is in CR, but we still have a few myeloma areas left. So this is something where the imaging really gives us more information. And we use computers, and Jenny was talking about big data. We try to teach our computers to learn to help us analyze images, because I can tell you a whole body low-dose CT, a whole body PET, and a whole body MRI, each one has about 2,000 images. And our radiologists have a new diagnosis. They have the scrolling finger, because on the computer they have to scroll through. And this we try to teach our computers to help us to identify those focal lesions in the body.
Besides advances in instrumentation and AI, what other progress is being made?
That is, I think, one very valuable tool, but there's also development of better tracers for the PET CT, kind of the dye of the PET CT, where the CD38, which is the target of daratumumab, for example, and isatuximab, and this CD38 is very specific for myeloma cells. So some colleagues have started to attach the tracer to the thing that is lighting up in the imaging, attach this to the CD38 antibody, and then you see much more with a much higher sensitivity and also much higher specificity where the myeloma cells are. So the CD38 directed tracers in PET CT and or the diffusion weighted imaging are two areas where I think the future will go with imaging in myeloma.
What other ways is imaging being used to assess myeloma and guide treatment?
I think better tracers, better techniques by itself, and also the combination with other things. What we do right now is we detect with imaging where the myeloma is taking place, and then we do a guided biopsy. We also do the regular biopsy that we do at the iliac crest, at the pelvis, but we also do a biopsy in some patients of an area where we have an osteolytic lesion, for example, and we found that there are genomic differences. So it's not the same cells. So that might be another area where imaging can help us.
Imaging is getting better every year, and the primary engines of this improvement are improvement in the contrast agents, especially in positron emission tomography. So if we can have more specific contrast agents that target specific biomarkers on the myeloma tumor cells, we'll get much better about diagnosing tumor cells. The existing contrast agent, which is FDG, used for PET imaging, it has done a huge service for myeloma patients. However, we, as a scientific community, we have an understanding that we need better, more specific contrast agents for imaging myeloma cells within the bone marrow. And so our institutions, we are looking at imaging very late antigen 4 on myeloma cells, which is very specific for an activated conformation of this receptor on the myeloma cells. And there are other institutions across the world who are looking at different myeloma-specific contrast agents. So in addition to the improvements in the instrumentation, which is a big part of PET technology, we are also making advances in developing more specific, safe, robust imaging agents, contrast agents.